Vision changes after the age of 40 are universal. 100% of people experience difficulty focusing on near objects over time. This is called presbyopia. It occurs because the eye lens loses elasticity. We have a lens in our eyes much like the camera lens in a camera. It can change its shape when we want to focus. Similarly, the camera lens changes its form when focusing on objects. When the eye lens loses elasticity, changing its form becomes difficult, and we are unable to focus sharply.
On the other hand, a person requires more light to see clearly. This occurs because with age, the pupils reduce in size and less light reaches the eyes. We cannot stop these changes because it is a natural part of aging. Normally, the person should not experience vision loss to an extent that it affects daily life. If it occurs, it is never normal, and a diagnosis is required to determine the problem, as well as the appropriate treatment. We discuss the top 7 causes of worsening vision over time. Refractive errors are the most common cause of eyesight problems. This means that the eye is unable to focus light exactly on the retina. It is similar to a situation in a cinema theater. The movie is not projected exactly on the screen, and in this case we see the movie as blurred and less sharp. The same happens with the eye if light is not focused on the retina, which functions like a screen and perceives the environmental light. In this case, we see a blurred environment or objects. There are 3 forms of refractive errors.
1. Nearsightedness and so-called myopia means that a person is unable to see distant objects clearly. It occurs because the light is focused before or in front of the retina. Nearsightedness requires minus lenses or glasses. A person with nearsightedness is unable to see road signs, the whiteboard in a class, and may squint excessively to see distant objects, often sitting closer to the television. 2. Farsightedness means that a person is unable to focus on near objects. It is called hyperopia. In this case, the human eye focuses light behind the retina. Farsightedness usually occurs when the eyeball is too short or when the cornea is too flatly curved and it requires plus lenses or glasses. In this case, a person finds it difficult to read or work at a computer, experiences eye strain and headaches during close work, and sometimes even blurry distance vision occurs with age.
And 3rd, astigmatism occurs when a person is unable to focus both near and far objects properly because of an irregularly shaped cornea or lens that is more oval than round, causing light to focus on multiple points instead of one. During astigmatism, the person experiences blurry or distorted vision at all distances, difficulty distinguishing similar letters or numbers, as well as common eye strain, headaches, or squinting. The most effective treatments for refractive errors are corrective lenses, glasses, or laser treatments. The 3rd most common cause of worsening vision is cataracts. It is the clouding of the human's natural lens in the eyes. It is similar to the windshield of a car becoming foggy and requiring clearance to see clearly. The most common signs of cataracts include a sense of looking through a foggy window, difficulty seeing at night, excessively bright tar light or indoor light appearing too bright. For reading, you might find yourself needing much brighter light for activities such as reading or other close work. Cataracts are usually associated with age-related changes of the lens. Additionally, diabetes, alcohol consumption, and excessive sun exposure are the primary risk factors. The only definitive treatment for cataracts is surgery. Cataract surgery involves removing the clouded natural lens and replacing it with a clear artificial intraocular.
Another cause is dry eyes, an extremely common problem, especially in people who spend a lot of time at a screen. When the eye surface is irregular due to dryness, light scattering increases, which can reduce contrast sensitivity and make it harder to see fine details. Long-term dryness can lead to ongoing discomfort, eye strain, and headaches. The most common treatment is screen breaks, following the 20-20 rule, every 20 minutes. Look at something 20 feet away for 20 seconds helps maintain tear film stability, along with the use of artificial tears. Omega-3 fatty acids have been shown to help improve the quality of the tear film in some individuals. Another common cause is age-related macular degeneration. The macula is the central part of the retina, which is responsible for detailed vision. Small yellow deposits called drusen accumulate under the retina. Their presence indicates the progression of the disease. There are two types of macular degeneration, wet and dry. The wet form progresses faster and causes vision loss. It causes abnormal blood vessel growth beneath the retina, and these blood vessels leak fluid, causing severe symptoms. The signs of macular degeneration include difficulty recognizing faces, reduced contrast sensitivity, straight lines appearing wavy or bent, and blind spots in the center of the visual field.
Increased difficulty performing close tasks in low light conditions is also common. Macular degeneration is common in people after 60. A family history of the disease and smoking are the most important risk factors, while oxidative stress, obesity, and high cholesterol are also important contributors. For treatment, high-dose antioxidants and zinc are used. They slow the progression of the disease. Another important disease is glaucoma, which is a group of diseases in which the optic nerve is damaged due to increased pressure inside the called intraocular. In the early stages, it has no symptoms. Later, in advanced stages, patients may notice difficulty seeing objects to the side, bumping into objects, or eventually experiencing tunnel vision, where only central vision remains. Another important form of glaucoma is acute angle closure glaucoma, less common but a medical emergency. It is characterized by intense eye pain, nausea, and vomiting, sudden blurred vision, seeing halos or rainbows around lights, and redness of the eye, common symptoms. Another disease is diabetic retinopathy. In this case, retinal blood vessels are damaged by diabetes, causing vision loss. Initially, there are often no symptoms, and vision may be completely normal. When the disease progresses, blurred vision may be gradual or fluctuate day to day, especially if macular edema, which is swelling, is present. Floaters, which are spot specks or cobweb-like strings floating in the field of vision, can be due to small amounts of bleeding.
Other, more serious diseases also exist, such as retinal detachment, a medical emergency in which the retina separates from the back of the eye. Though relatively rare, it can lead to permanent vision loss if not treated quickly. Another condition is optic neuritis, which is the inflammation of the optic nerve and may be associated with systemic conditions such as multiple sclerosis and ocular tumors, for example, intraocular melanoma. Although rare, can cause progressive vision loss and require specialized treatment.